Welcome to the Master of Nutritional Epidemiology in Public Health. We are looking forward to informing you how this Master's can contribute to your ambition to become excellent in the field of epidemiology and public health, and to eventually improve public health. Since 2015, we have been running this online Master's program. This means that our online Master's exists already for more than 10 years. My name is Rosalie. As a study advisor, I am involved in this online Master's since the start of this Master's. I do my work as a study advisor with a lot of joy, and I consider our online Master's students as a very special group, interesting group also. And today I'll be moderating this session together with Dr. Amanda Jager and Professor Ellen Kampman. And we will give you an overview of our online Masters and do our best to answer all of your questions. Please feel free to post your questions in the chat and we will try to answer all of them during this webinar. Ellen, could you introduce yourself, please?
Yes, certainly. My name is Ellen Kampman. I'm a professor in nutrition and disease. I'm a nutritionist by training, but finally chose to do epidemiology as my specialization.
Yes. Thank you, Ellen. And Amanda, can you introduce yourself?
Yes, of course. Well, my name is Amanda. I have various roles in the program. I'm involved in the content and the structure of this program as a program director. And I work as a study advisor, and I coach and advise, well, this lovely group of students together with Rosalie.
Thank you, Amanda. Well, in the next 40 minutes, we will tell you a lot about this Master's program, Nutritional Epidemiology in Public Health. And we have divided our presentation into 4 parts. The first part is about the content of the program. The second part is about with an example of a course. The third part is the structure of the program. And of course, we'll tell you all the details about the admission criteria. But we are also very curious where you are coming from. So what are you currently up to? Are you still studying, or do you have a job that you wish to combine with your studies? And what would you like to find out during this webinar? Please type that in your chat, and then I would like to show you in the next slide where our current students are coming from. As you can see on this world map, we have students from all over the world. From Australia to Canada, from South America, all over to Europe, but also in Asia, such as Iran, Pakistan and Bangladesh. Some of them might have moved to the Netherlands, or students have moved from the Netherlands to outside Europe, all over the world actually. We are really proud to have such a diverse student population in this Master's, because this international setting makes our Master's program very unique and also well appreciated. And by having said that, I would like to ask you, Ella, why is this program, this Nutritional Epidemiology Public Health program, so important?
It's a very important program. I would say, because we are dealing with all kinds of chronic and infectious diseases all over the world. And of course we want to know what is causing these diseases. And it's not only risk factors like physical activity or obesity, but you also have to think about diet as a very important risk factor for these diseases. And when people are having a disease, you also want to know what can we do to support these people, to increase their quality of life. And also here we need scientific evidence to be able to prove that. And also with these scientific results, we want to change policies all over the world. We want to give advice, guidance to professionals, to patients, to the general public. And that's why this course is so essential.
Thank you. Thank you, Anna. I already have some information coming in from our audience. That's very nice. We have on board a nurse from Italy, a dietitian also from the Netherlands, food science and nutrition from Greece, a medical doctor from Germany. Maybe it's nice to reflect on this. This is also is a bit similar to our current student population in this master's, isn't it, Amanda?
They sound very familiar.
Yes.
Yes, yeah, the countries, but also the jobs that they have.
Yeah.
And well, I think our alumni can only agree that this master adds upon these jobs. Yeah, it really enriches that, like the medical doctor and the dietitian. Yeah.
Yeah, so you're at the right place to listen to and view us at this webinar. That's why I also want to make a link to our alumni, a few of our alumni, of course. And these students already graduated a while back. And on the left side, you see Raymond. And Raymond did a bachelor's in statistics. He already built up his impressive career. And then he decided to do this master's. And this master's degree actually enabled him to go further in his career at the United Nations, at the World Food Program in Rome, in Italy. And nowadays he's working as an evaluation officer. On the right side we see Anna. And Anna did her bachelor's in food technology. It's a bit a different field than what we've heard before. So she needed a linkage study which enabled her to start within this master's. And she succeeded in completing this master's within 3 years. And we come back to that, the 3 and 4 years later onwards. And to her surprise, she really got passionate about doing research. She was not expecting that, but she really got passionate about it. I believe she even had a final conversation with you.
Yes, yes, I remember her. Yeah.
Yes, during the exam.
Yeah.
Yes. So after graduation, she started a PhD project on the prevention of dementia, with a main focus on sleep, but also the other lifestyle factors, like you already mentioned before. And she uses the prediction models during her PhD. On the left side below is Jessica, and Jessica is from Canada. And she did her bachelor's in nutritional sciences in Canada. After studies, she started working as a risk assessment assistant, and she followed this master's to eventually follow her dream of becoming an epidemiologist, which she currently is doing now. And last is Dimfy on the right side below, and Dimfy did a bachelor's in nutrition dietetics in the Netherlands. And first she worked for a couple of years as a dietitian, and then she followed our master's, which she also completed within 3 years. And now she has been working for a couple of years already as an epidemiologist on the topic of whooping cough at the Dutch National Institute for Public Health and Environment. And by giving you these 4 examples, we hope that you get an idea of how diverse and how broad the field of epidemiology and public health is. And Amanda, I would like to ask you to tell us in the next 6-7 minutes about the content of the master's program.
Yes, I will tell you more about the content and what you will actually learn within this program. Well, in this master's you will learn the methods to investigate the links between health status and nutrition. You will learn how to design an intervention or an observational study, and you will learn how to analyze the data from these studies by yourself. Furthermore, you will learn how to draw conclusions from this data, and you will learn how to use these findings and apply them to public health policies or use them in dietary guidelines. And altogether, this master allows you to have an impact on the health of the population. And in a way that fits to your ambitions and also given your background and the work that you're actually doing. And before I dive into the real details of the program, let me tell you more about the unique features of this program. Well, this online master, Nutritional Epidemiology in Public Health, is truly unique. And the first unique selling point is that it's designed for part-time study, which means you can combine your study with work, with family life, or with other responsibilities. And like Rosalie said, the program lasts for 3 to 4 years, and later on I will explain what is the difference. In the first 2 years you will follow courses on our fully online learning platform. And although the program is online, you are certainly not studying alone. You will work closely together with lecturers, tutors, fellow students in a fully virtual environment. And the courses you take within these first 2 years, they prepare you step by step for a tailor-made thesis and eventually your master internship. Throughout the program, you will also get personal guidance from our lecturers and supervisors, such as Ellen, but also the study advisors, Rosalie, and myself. And what makes this program truly special is the flexibility it offers you. So you can decide for yourself when you want to study during the week, at the moments that fit to your personal schedule. Can be in the weekends, can be in the evenings, and that said, flexibility does not mean total freedom, because there are still assignments and there are group work assignments with clear deadlines, and there is always an exam at the end of a course. And this is a very important difference from many self-paced programs, which often do not lead to an accredited diploma. Because in contrast to these many self-paced programs, this master program is internationally accredited. And this means that the diploma of the online master is fully recognized and you obtain a full Master of Science degree, just as if you would study here on campus. So there's no difference between the diplomas. The key difference is that you do not come to us in Wageningen every day. You visit Wageningen virtually, and you do this via virtual classrooms, online discussion forums, and also by working on individual assignments or group assignments within these courses. And one other crucial aspect of this online master is that it's organized on a part-time level. So on average, you're expected to spend about 21 to 24 hours per week on your studies, and you can schedule these hours yourself. And this flexibility is essential because our students, like Rosalie showed before, they come from all over the world and across many time zones. And you just saw the example of Jessica, who studied here from Canada. And I remember she was in a cohort together with someone else from Australia. And while they were working on a group assignment, well, Jessica went to bed and the other one got up, and they were working around the clock, and it worked very efficiently for them.
Very good.
So therefore, this flexibility is really essential. And it also allows you, well, to build this expertise in the nutrition epidemiology step by step and gather all necessary ingredients to become a nutritional epidemiologist yourself. And I also want to illustrate that in the next figure. What you see here is a shopping list. We like to go shopping, so we thought, let's present what you will learn in this master's in a shopping list. Well, each checked item on the list represents an essential ingredient, and all these ingredients are necessary to become a nutritional epidemiologist. And therefore, well, all these points come back in the curriculum. First, a nutritional epidemiologist must know how to design and evaluate population studies. And this means you need to understand which study designs are appropriate for different research questions and how these choices, how they influence causal interpretation. Without this foundation, research findings cannot be trusted. Next, a nutritional epidemiologist must be able to analyze and interpret data. Data that's already existing, but also your own data. Nutrition and health research relies on statistical analysis to separate real association from random variation or biases. Correct interpretation of effect sizes and uncertainty is also essential to avoid misleading conclusions. And because diet is the main exposure of interest for this field, a nutritional epidemiologist must also know how to measure dietary intake. And this includes understanding the common dietary assessment methods, also those used in dietetics, and also recognizing the limitations, such as measurement errors or imperfect validity. In addition, another one to the list, a nutritional epidemiologist must understand how diet relates to health and disease. And this involves the interpretation of epidemiological evidence in the light of the biological knowledge, ensuring that your statistical findings are meaningful and plausible, that it means something that you found. And as you will probably agree with me, no single study provides a complete answer. Therefore, a nutritional epidemiologist must also be able to critically appraise and synthesize evidence across studies, so not only your own study, but overlook the whole field. Judge the quality of research and the consistency, and you also need to integrate the results through systematic reviews and meta-analysis. I also want to highlight the need for the translation of evidence to the public health, also Ellen mentioned before. Nutritional epidemiology aims to improve population health. So these findings need to be translated into prevention strategies, guidelines, policy relevant recommendations, etc. And finally, the shopping list ends with the ability to communicate these findings clearly. Evidence only has an impact in society when it's explained accurately to scientists, policymakers, and the general public, including clear communication also of uncertainty and limitations of studies. While taking this whole list together, this shows that a nutritional epidemiologist is not defined by one single skill, but by the careful combination of methodological knowledge, knowledge about nutrition, about dietary assessment methods, public health application, and lastly also clear communication. And later on in this webinar I will show you more about the structure and how we have organized this online master. But that is the shopping list for now, Rosalie.
Thank you for an extensive shopping list indeed. Nice
Impressive.
to hear. We get some questions coming in, and we addressed that we have students from all over the world. But what we didn't address, but I think it's good to mention that also, is that also in the audience we have people, listeners who just graduated or who are already working for a couple of years or even 10 or 20 years in the field. Maybe it's nice to reflect on that, what is our current experience on that.
Yes, yes. Do you want numbers, Rosalie? We're making
nice.
a study about epidemiology. Well, I don't have the stats here,
Yeah.
but I think on average the age is between 30 and 35 of the group. And also good to realize it's a quite selective group of students that start with this program. So we don't have hundreds of students in this online program. It's about 25 students that start every year.
Yeah.
A very nice, closely connected group with each other. The groups that we have now, they also have WhatsApp groups and some meet for drinks even. And like I said, the average age between the 30 and the 35, but we also had people of age 70 in the program.
Yeah.
Yeah.
And also who just graduated like 22 or 23 years old, right?
Yes, also those that were just graduating from the applied sciences, dietetics degree, for example.
Yeah.
And they started working, but they still wanted to get a master's degree.
Yeah.
And they combined that. Yeah.
That brings me actually to the next question, and maybe it's nice for you because you also see the students doing the oral exam after the master thesis. What is your experience or opinion on should these students within our online masters, should they already have work experience when they start with the masters, or it's not that necessary? What's your feeling about it?
Both, I think. It doesn't really matter whether you have experience or not. It's always nice if you don't have any knowledge to start with this and be surprised of what you can learn. We also notice indeed that a lot of the students are professionals in their field, which is also very nice because they bring a lot of experience. And what is also interesting is that they work together, so they can also exchange knowledge.
Indeed.
And then we have them coming from these different directions and also different disciplines, and that also brings, more knowledge at the table, but also makes this group for us as supervisors a really great group to work with.
Nice to hear. So.
Yeah, I like it.
Yeah. Nice, thank you, Elle. Well, the floor is yours. We would like to continue with an example of a course which you also are teacher in.
Oh yeah.
Yeah.
Okay, let's focus on this course, Nutrition and Non-Communicable Diseases. This is a course which I specifically like because it's really on diseases which are very frequent, like cardiovascular disease, diabetes, cancer. So 1 out of 2 of us will get one of these diseases. And we really need to find answers to prevent these diseases from happening all over the world. We need to know what are the biological processes underneath these diseases. And that's what we will teach about. We discuss diet and genetic susceptibilities, and some people can eat everything and they don't get a disease, and others get a disease anyway whenever they eat healthy. So we need to understand that, and that's the gene-environment interactions. And of course, when you look at diet and nutrition, you should also take other risk factors into account. So also looking at physical activity, sleep, stress, to take that into account in your analysis is very important as well. And ultimately, we want to come to these guidelines for policymakers, for professionals, based on that knowledge. So that's a course we teach on that content.
Thank you, Helle. I think we move on to the next slide, which is about teaching methods.
Yeah.
Would you
Yeah,
like to address that?
Yeah,
Yes.
I could start. I think that in the whole program, what I really like is that there are these diverse methods of teaching that are used, which also makes it nice to teach, but also for students I think this is interesting. Well, in this course we have a lot of knowledge clips from professionals who like her, who discusses about, in this case, the survival rate of cancer all over the world, but all kinds of knowledge clips for these different diseases. But the students also make their own knowledge clip, and they have to exchange that among one another and also comment on that in the discussion boards, so that's interesting as well. Of course, these knowledge clips have to be based on scientific literature. And we also have assignments, like for instance, patients' questions about what can we eat and what can't we eat. And also here they have to look at the literature, which is sometimes inconsistent, and find out what is causing this inconsistency. For instance, let's think of an example. Eating potatoes may increase your risk of certain diseases, but it might also decrease your risk. And that's, of course, depending on how the potatoes are prepared. So you can imagine that fried potatoes, like the French fries, will increase your risk of heart disease. And so the studies in the States may show that, while the studies in the Netherlands, at least for a traditional Dutch diet, we boil our potatoes and we eat them with vegetables, for instance. So the context of how you eat it, we need to think about that, and that's certainly something you will learn in this course.
Very useful. Thank you. And you mentioned the assignments. There's a question from someone from the Haagse Hogeschool, and she or he asked, well, what is kind of the ratio between the group assignments and individual assignments? Maybe Amanda, that's a question for you.
Yeah, that's a question we never had before, but if I look overall over the whole program, there's a diversity. That, of course, every course has different assignments and a different amount of knowledge clips, but I believe that the number of individual assignments is larger than the group assignments. Well, if we look at discussion boards, that is not really an assignment, but that is where you interact with each other as well.
Yeah.
And usually the teacher is also on the discussion board, but not as active as the students, but more leading the discussion. Or pointing into the right direction. But what I like about the discussion board is that you see that students help each other.
And you learn from each other also. Yeah. And I believe the teachers really get involved when the discussion goes into the wrong direction, when some theory is not correctly interpreted.
Yes, of course, then we interfere. If we see that the discussion is going into a wrong direction, of course we try to get it back on track. Yes, that's certainly what we do.
That's a nice thing of it, So what I remember also from the courses, it builds up. So in the first courses, it's more individually, and then slowly you start with group assignments also.
Yeah, and we have 2 large group projects, and I will get back to that soon.
Good. Now we've heard about the courses, and students will need to be graded somehow. So how does that work? Do they need to come to Wageningen for an exam every 4 weeks, or it's online masters? So
yeah,
how?
and they make the exam on paper. No, that's not what we do. So now for 10 years we have remote proctored exams. And we have scheduled the exams always on the last Thursday of the period. And the course usually runs for 4 weeks. And then the last Thursday in week 4 there is a remote proctored exam. And you can decide for yourself when you want to start with the exam. So you need to start somewhere between 8:30 and 10 in the evening. So 8:30 in the morning, 10 in the evening. And once you start, you can not go out and go back again. And you need a camera, and you can use your phone for that. And the recording will show to the examining board or the examiner that everything went well and fair, for example, that you did not cheat.
Yeah.
So you also need to show the room, that there is no one else in the room. And in the beginning, you need to get used to that. It feels a bit silly to do so, but you will get used to that eventually.
You can't go to the toilet in between, eh? You have to plan that ahead.
Yeah,
as well.
you need to go. Yeah, exactly.
Yeah, indeed. At the start they're a bit nervous, but once they had 1 or 2 exams, they're really used for it.
Yes, and before the first exam, we always provide a tryout exam. So you can try out it for yourself, to do the room scan, and make sure that you're well prepared, because if you have your first exam and you're already a bit nervous, and then your phone is not working, or you didn't clean your room, or you don't want that stress at the moment that you want to start with your exam.
Yeah, but you mentioned the starting time is at 8:30 in the morning. That should be in the Netherlands, of course.
Yes, that's the Dutch time. Yeah.
But then they have to start at 8:30 in the morning, or they can choose, because you also mentioned something like 10 o'clock in the evening.
Yes, they can choose within this time frame. So this is Dutch time, so that
Central time.
Central Eastern time.
Yeah.
Yes, and the latest that you can start with the exam is at 10.
10
and
o'clock
usually
in the evening.
10
Dutch
o'clock in the
time, yeah.
evening. Yes, and usually you have 120 minutes to 2 hours to complete an exam.
Oh yeah, so if it's like 2 hours, you can't go to the toilet in between. Yeah, so that's something to think of, but you also get used for that.
Yeah, I never had complaints about that before.
No. Good. I think it's time to move on to the structure of the program. You already mentioned that. We have seen your shopping list, but how is this whole program built up?
Yes, I will tell you more about that. And I also have a nice picture that shows that. So here you see an overview of the first 2 years. And like I mentioned before, in the first 2 years you follow the courses. And each course takes 4 weeks, and they all end with a remote proctored exam. And my colleagues, they will also share the course catalog link, and you can look for all the details of the courses in there. The academic year within Wageningen has 6 periods. You could see that in the course catalog, but just remember, for the online master, courses always run one after another. So you always have one course at a time. You have an exam, and then you continue with the next. So it's a bit different in the planning if you compare it to the on-campus courses. In the first year, as you can see here, 30 credits is spent on a solid foundation in epidemiology. We'll have courses on public health policy, on statistics, but also nutritional physiology, to learn more about the biological status of the body. And that will prepare you for the second year, where we'll dive into the epidemiology and really advance your skills there. And you will also learn about dietary assessment more in depth. So the second year is more advanced. And as you can see here, you will earn 30 credits per year, so that is on part-time basis. You will also get projects. So these are the large group work projects that I just mentioned. And also training focusing on academic skills, like the argumentation skills, or working with R is also something they will teach you. And if we look at the 2 large group projects, the first one is on grant writing, and I will get back to that one. And the second one focuses on the improvement of sustainable food-based dietary guidelines. And in this project, you look at the dietary guidelines of a certain country, for example, Chile, and you look how can we make these guidelines more sustainable and also more focusing on the prevention of these non-communicable diseases. So that's what you're going to do in a group then. And what is also very nice in the second year is that we will invite you to come to Wageningen for 1 week. So I just mentioned it's virtually, or this master is completely online on a virtual platform, but there's 1 week that we invite you. And I just want to share with you what it looks like if people come here. So here you see some pictures of the Wageningen week. And the whole group of second year students, they will come to Wageningen and work on a project, and that is grant writing. And it's always related to a different topic, very interesting topic. And well, a new group has started this morning on this project. Yeah. And Ellen came up with the topic of liver fat and coffee consumption. Yeah. Yeah. And yeah, you're an expert in this field, so if people have questions about this, you can also ask Ellen. Yeah. And she will also supervise these students. So they started with the project now, they will do some preparatory work, and then in 4 weeks, or 3 weeks, I think even 3 weeks, they come to campus, and they will get to know the campus, they will experience student life in Wageningen, so they will have tours, and we will also explore the research facilities. And sometimes we do exercise together, as you can see in the right picture. And they will also meet and network with the teachers and also find their thesis positions. And according to many students, and well, I can confirm this, and I think you too. Yeah, it's always a very intense week, but it's the highlight of the whole study. Because you finally meet all the people that you have been working with quite intensively for the last 2 years, and you meet the teachers in real life. They will also join for lunches, and well, it's a lovely week. And I think every year the students ask, can you not do this annually? Can we not come back next year and do this again?
They're also friends, they become friends beforehand or during the studies, and then they finally meet in the second year. Yeah, yeah, it's nice to see for us also.
It's really lovely. I'm looking forward for the next one. Yeah. So it's still a few weeks and then they're here. Yeah. Well, this is then part of the second year, and after the Wageningen week, then there will still be some courses, and also Project 2 will be there. And all these courses together and the Wageningen week will prepare you for your master thesis. And that's what you usually do in year 3. And there you will do your own research project, and all the knowledge that you've gathered, it will come back and be combined there. And you can also see this here. So year 3 and 4, you can fill with a thesis and an internship. And let me explain what a thesis actually is, because the name might be a little bit confusing. With thesis, we mean in Wageningen, it's an independent research project, and yeah, you could also translate it to an academic internship that you do at Wageningen. So you're being supervised by someone from Wageningen, so that we can make sure that you have the good research skills, that you got them from our researchers. And this thesis that lasts for 6 months on full-time basis. And you can decide together with your supervisor if you want to do this on full-time basis, so 40 hours a week, or 30 hours a week, or 20 hours. So you can decide it yourself. And it's up to you to decide if you want to come to Wageningen to, well, maybe help with gathering data. But most of the students, they will work from home, so still virtually visit Wageningen, and they will work with a data set that they get from a researcher. And they will have, you know, well, close collaboration and supervision by a supervisor. And well, on the right side, you see the internship. So usually you do your internship after your thesis. And you can do that literally everywhere over the world. So if you're not in the Netherlands, you can also do that abroad. Or you can go abroad if you want to do your internship somewhere else. It can be at another research institute, can be at a governmental organization, a company. So there are many options there. And also Ellen, she will give some examples shortly after me. And this is also 4 months on full-time basis. And it will take longer, of course, if you do this on part-time basis. And some of our students, they well, got an arrangement with their job supplier that they can do the internship at their current job, which could also be very convenient and help to speed up also the whole program.
Yes. Yeah, I think it's first time to get some ideas of topics and also what do students really do during their thesis. Can you give us
Yeah,
some
so
clarity?
first of all, during the master thesis, where we supervise them very intensely, so these are our projects, so they're really working on projects that we do, so
Yeah.
that's why it's real data.
Yeah.
And so, for instance, they can work on data sets with knowledge on nutrition deficiencies all over the world, but also nutrition deficiencies in people who had bariatric surgery, for instance, and see how that influenced their health, but also influence regain of weight, for instance. So that's something we are working on. We are working on people with a certain disease, so people who experienced a myocardial infarction, and we want to know how could we prevent a second one from happening. So you can do analysis in that. You can also work with people who do not have a certain disease yet, but you want to know through international cohort studies, for instance, that we are also working on in our division. For instance, how is ultra-processed foods, for instance, influencing the risk of certain diseases? So we have an expert in the field who's supervising that.
Yeah.
So those are master thesis
And
options.
when you mention analyze, what does that mean, analyze?
Well, it means that you will have a data set with all the data from the different individuals who answered questionnaires, or we have blood samples maybe from them, sometimes hair samples, fecal samples, and you're going to do the analyses. So you're going to look through all the data and trying to find some associations, and this is like I always think it's like a detective, like who did it. So you're trying to find the clues in such a data set, and that's what you also get the tools for, to be able to analyze those
and
data.
those tools you get already during the courses, isn't it?
Yes, of course. So this is also where you put your theory into practice. And I must say that as a student, I found that the most interesting part, because now you know why you learned this.
Yes.
Yes.
Yeah, and then you learn also about statistical programs like R you mentioned already, and I also got a question about Stata. I believe that's also in one of the courses we provide in our masters.
Yeah,
you also learn
when
about Stata.
when you got to really use it,
Yeah.
you see how useful it is,
Yeah.
but also how easy it is to use such tools. These are tools,
Yeah,
right?
these are tools.
So, just by using it, you can make structures and you can see what's happening.
Yeah, but it's not that a statistician does the work for you. You do it yourself.
Yeah.
Because you are doing the epidemiology on it.
Yeah, so it's not statistics.
Yes.
It's really data analysis.
Yeah, that's something different.
And you use these statistical programs, but they're there to support you. So for an epidemiologist, it's far more important to look at the data, interpret the data, and try to understand the data. So really make a full picture of what is happening.
Good, nice, yeah. There's another question, and I think it's good to mention that here, because we teach a lot on epidemiology, how to apply it, how to do it, and also the master thesis, you apply epidemiology. Can students also become a registered epidemiologist? Like here in the Netherlands, we have this association for epidemiologists. Is that also possible within this masters?
Certainly.
Yeah.
Yeah, and we also guide you. I think you do a large part of that. we guide you through what is necessary.
Yeah.
So, for instance, if you want to become a registered epidemiologist, you also need to do your internship
Yes.
together with an epidemiologist in an epidemiological setting. If you do not want to register, you can be more free and go everywhere and do everything. But if you want to be registered, yeah.
Yeah, then it's important
Yeah.
to do that. Now we also have a question about the internship, but maybe you can first give an example of an internship.
Oh yeah. I brought a couple of internship options because sometimes, as you already mentioned, people like to do that in their own institute close by. So, for instance, we had a dietitian from the Nutrition and Healthcare Alliance. There are several hospitals within this region of the Netherlands, and she wrote a research protocol on carbohydrates during prolonged labor. So people who worked long hours, what should they eat? And also night shifts, what can we do with that? And she prepared a data analysis plan for that. There was also somebody who already worked there, an International Life Science Institute in Europe, ILSI Europe. And he scientifically contributed to an expert report on proteins and carbohydrates. So he went through the literature, analyzed the literature like a meta-analysis.
Yeah, discuss also with experts, isn't
yeah,
it?
And exchanged it with experts in expert meetings, and developed a perspective paper, but also drafted recommendations.
Wow.
After that, so that was a hell of a job, but very nice. I
imagine.
understood. Yeah. And then there was a person from Exeter, from the University of Exeter, and she wanted to do something about the evaluation of menstruation patterns, and then she had a tracking app to ask women what their experiences are, and she had this very large data set from that. So that was really interesting as well. So there. Many different options there.
And how would that work for a student if he or she is searching for an internship? Do we help them find it, or do they use your network to find it?
It's what they want.
Yeah.
If they come from a specific institute and they say, but we have very nice data, okay, be our guest.
Yeah.
But if you do not have anything, we have all kinds of addresses where they can work and try and
Good. And well, this is an online master's, of course, so I can imagine if someone is living abroad but still wants to do an internship, maybe in the Netherlands, could that also be performed online? From a distance.
Yes, it's always possible because these data sets are there.
Yeah.
You can work at it from your home, but you have to talk with your supervisor, of course. If what do I see? Is this clear? Do I make mistakes, etc., etc. So that's closely also looked at. But it can be anywhere in the world.
Yeah. Because you always get some supervision, of course, from the internship organization as well. Yeah. Let me see if I've answered all the questions so far. Well, a completely different question is, when does our master start? We didn't address that. When is our academic year starting?
This academic year, so upcoming, it will start on the 31st of August.
Yes, indeed.
Yeah, so it's always around the start of September, end of August.
Yeah, so beginning of September.
Yes,
we start.
and also good to mention that the 2 weeks before we actually start, we open access to an onboarding page on our virtual platform, which is called Brightspace, and there you can already get to know each other. You can see some of the material, and you can do the tryout exam, for example. It's also there.
Awesome. Yeah.
So you can already get some experience and prepare yourself before the actual start.
Good. I have 2 more questions. Once again from the Haagse Hogeschool. Is it also possible to specialize within this master? Because we've given the courses, those are fixed. But can you also specialize them maybe through the master and through the master thesis and the internship into a certain direction?
Yeah, maybe you could specialize in a certain disease that you're really interested in.
Yeah.
We have a medical doctor at the moment who also wants to do this master, and so she does that at nearly at the same time. And she said, I want to specialize in rare diseases.
Yeah.
How could I do that? So we
Nice.
help her with finding enough data on rare diseases, which is not easy. But yeah, so she specializes in that. Or maybe you want to specialize in cardiovascular diseases or in infectious diseases.
Yeah.
Or in cancer.
Yeah, and well, you also speak to the student at the end of the studies and sometimes also at the graduation. Do you also see that our students, our graduates, get their first job through the internship?
Yes, that's sometimes what you see.
Yeah.
And therefore you can also choose, maybe wisely, if you want to have a job there.
Yeah. Nice. Yeah.
But also the other way around, that people already have a job and then they do their internship there.
Over there.
Yeah.
Yeah. Yeah. Now I have to read a very practical question. Well, will you get access to the scientific articles, to the scientific platforms during the masters? Is that somehow arranged? Can you get access to PubMed articles, for example?
Yes. All the literature that we give to you in the form of articles, you will get access to that.
Yeah.
So you will also get a login to our university library, which you can also use to find all these articles that are otherwise behind the paywall.
Yeah.
And for some of the courses, we also recommend some books, but most of the courses we have a list of articles that we provide.
Yeah, yeah. So through the library, there's access to actually all the scientific journals.
Yeah.
Yeah, good. And one more question. Oh yeah, that's a nice question. It's from Robert. Are we supposed to have a good foundation in nutrition, or will we learn a lot about that during the courses? Elle. Yeah, and maybe we also reflect on that for the admission criteria, but maybe it's nice. But do you really need a strong foundation in nutrition when you start this masters?
No, I don't think so.
No, I agree.
Maybe no.
Yeah.
You can do that without the foundation.
Yeah.
Of course, we have dietitians who have a strong foundation, and sometimes nutrition is to start with, but it's really not necessary. We also see medical doctors who usually do not have such a strong background in nutrition, but that works very well.
It's more like an interest, having an interest in nutrition.
An interest would be nice, yes.
Yeah, because often you use examples and you mentioned the lifestyle factors, and that also includes nutrition or dietary intake, of course. Yeah,
of course. But you can also do, and if you're a bit bored about nutrition or something like that, you can also focus on other risk factors, like I said, sleep, sleep quality. That's also a very interesting one. So that's also possible.
Good. Well, thank you. Those are the questions for now. So I think it's time to when I say it's not time yet, are internships always research-based? It's a question from Sonia. I think that still was part of this.
Yes, it's still part of this. If they're always research-based, that was the question. Yeah, it really depends on the kind of internship position that you found. So sometimes you can also work for a company, for example.
Oh yeah.
But you're always doing some kind of research.
Yeah.
So yeah, it's always related to research.
Yeah.
It's not like you're working in the grocery store.
Or marketing or something.
Or marketing.
Like that.
No, that's a different discipline or expertise.
Yeah. You always have to deliver reports, as kind of a scientific report, right?
Yes, most of the times also for internships, yes.
Yeah, good. Okay, now it's time to move on to the summary of this masters. That's for you.
Yeah, let me summarize what we together just told you. So our master consists out of 2 years of part-time courses that you follow on different topics. We will give you a good foundation in the epidemiology, the public health, but also physiology and nutritional assessment methods. And that is in the first 2 years. Year 2, you will become more trained in the advanced courses. After that, you can continue with a thesis, which you will perform on the supervision of one of our teachers here at Wageningen University. And after that, well, the whole world is open for you to do an internship somewhere related to the nutrition or health, as Ellen just stated. So the total duration is 3 to 4 years on part-time basis. If you decide to speed up and work full-time during your thesis and your internship, then you can be done within 3 years. So some of the examples that Rosalie gave in the beginning, they finish the masters within 3 years. And sometimes we also have these solutions for people that are in 2 programs. But that is something to discuss with one of us. And during this 3 to 4 years, you don't have to come to Wageningen. Of course, you're always welcome to come for coffee. But there's 1 week in Wageningen which will invite you to come here and spend a lovely week with your fellow students and also get to know Wageningen, the teachers, and work on a group project. And I think that completes the whole study. And then...
I think so, indeed. Well, that brings us to the admission criteria. So I can imagine that you're wondering whether this program is the right fit for you. Next, please. And ideal, we are seeking the candidates who wish to advance their expertise in nutritional epidemiology and public health. So I can imagine if you have a background in health sciences or nutrition or something related to that, then this we hopefully is appealing to you. Some of our students have been working already as a healthcare or nutritional professional, or maybe also in policy and research staff. So how does this translate to the official admission criteria, requirements? And that is that you can become admitted to this program if you have a bachelor's in one of these areas as mentioned here in this picture. For example, a bachelor degree in nutrition sciences or biomedical sciences or medicine, like you mentioned already, but also bachelor's in nutrition and dietetics or health sciences is possible as well. So it might be that in your country where you followed your bachelor, the title of your bachelor is slightly different, but you can always ask us or send us an email about it if you have a question about the admission. Next, of course, to a relevant bachelor degree, you also need to have a good or an average mark of a 7.0 or a GPA of 70%. Also that if your average mark is not reflecting that, you can find it on our website, more information about it and about the specific requirements for the country where you followed your bachelor's. And finally, you also need to have to prove your proficiency in English and check the website how to do that, because it's always, there are lots of criteria for that, but it's always it's good to check what are the real criteria to your situation. You can apply to our program via StudyLink, studylink.nl. Please do so before the 15th of June, so you have ample of time for that. And also, if you haven't completed your bachelor yet, you can already apply for it, but we expect you to be done with your bachelor before the 31st of August. We haven't received any question about the scholarship, but the information on about scholarships is on the website as well. Yeah, so let me elaborate on the application deadline. It's the 15th of June. Before that time, you need to have started or opened your application file, but in the end, you need to have submitted everything before the 1st of July. So that's important. The diploma, your official diploma, if you receive it after the 1st of July, you can still apply, of course, but then you need to have it submitted before the 31st of August, the official diploma. You can always apply. That's the main thing. That brings me to the next conclusion, or to conclude, is that Amanda and Ellen, you've given us a lot of information about our masters, and I really would like to reiterate that our online master is a unique program, and it's specially designed for part-time students to combine work and studies in the context of lifelong learning. First, you follow courses for 2 years, and then that really prepares you to do your master thesis, and finally you will complete your studies with an internship. During the courses you closely collaborate with your teachers, with your fellow students, and we as a study advisor give you a personal guidance. And the emphasis in our masters is on teaching you everything about epidemiology and public health, not only the theory, but also how to get your hands on through your thesis and your internship, such as how to perform epidemiological data analysis and how to construct a public health intervention program. And finally, the aim is to improve population's health. That's the main summary of our masters, but also we would like to stress that our program gives you a flexibility to decide when you wish to study during the week. I think it's nice, or thought it's nice to conclude this webinar with a few quotes from our students. One mentioned that is love that you usually learn one subject at a time. And another one is that through the visualization of the theory, it feels like you study on campus. Even though it's all online, you have this connection with your students, with your fellow students and teachers. And it's also fun to be in a classroom with people from all ages and walks of life. That brings me to the final end of this presentation. I would like to thank you, Amanda, for telling us a lot about our master's program, and Ella for giving you insights of the courses, but also the thesis and internship. When you have questions, you're always welcome to contact us through emails or through the website. The email is mentioned above, bvg.mnh@WURt.nl. And I would like to thank you for participating in this webinar, and we hope to see you again. Thank you.